2 years ago, the European Society for Medical Oncology and the International Association for the Study of Lung Cancer successfully organised the first European Conference on Lung Cancer. Rolf Starhel was the steering committee chair for ESMO of this second meeting.
We have almost 1,700 registered, and this is more than 20% more than during the last meeting 2 years ago. Now, importantly, this is a multi-professional meeting. The scientific objective is, on the one hand, it is an educational part. On the other hand, it's a look in the future, how things are developing, where are the new issues. My hope is when people leave here, they go out to their area of work with some optimism and the drive to improve the issues for our patients.
Paul Bunn is the IASLC Executive Director and co-chaired this second ELCC Steering Committee.
ESMO and the ISLC have other meetings in the other years, but they've agreed that on an every other year basis there's more than enough information to do this, and they've agreed that doing it jointly increases the amount of interaction and sharing of information. So it's a win-win situation. There's two challenges, but in terms of therapy, we now want to deliver therapy that's based on the properties of an individual's tumor. That's personalized medicine. And of course, in terms of early diagnosis and prevention, we ought to be able to take advantage of these molecular findings.
During the ELCC 2010 opening ceremony, Dr. Ala Alwan, Assistant Director General of the World Health Organization, addressed the key issues of the common fight against tobacco that physicians and nations must lead together.
About 5 million people die every year because of tobacco, and tobacco is the only product that actually kills half of the people who take it long term. The World Health Organization now has a clear roadmap for tobacco control. There are 6 proven cost-effective measures that every country can take irrespective of the income of the country. Oncologists, clinicians have an extremely important role also in taking an active part in implementing tobacco control measures in their own countries, educating the health professionals on tobacco control, in educating the public on tobacco control, and in making sure that they create in their own environments an environment that is conducive to tobacco control.
Carolyn Dressler is a thoracic surgeon who's now director of the Tobacco Control Department of Health of Arkansas. She was invited during this opening ceremony to share with oncologists what they should know about tobacco.
We need to have tighter regulations on the tobacco industry. They've been allowed to get away with too much for too long, and they cost us as humans, as a society, too much. We need to regulate them. We need to put them out of business, basically. As healthcare professionals, we need to help our patients stop smoking. We all need to stop smoking. We need to help our patients stop smoking. We need to get them off of nicotine. Once a person has cancer, it's critical because of the chemicals that are in cigarettes that they help their patients stop smoking. If you're going to treat them with the therapy that we have today, it often works at the same place chemicals in tobacco work, and they would counteract each other. So studies have shown that if people are smoking during their therapy, they have worse outcomes. I'd say help your patients stop smoking. If you really care for them to have a good outcome, get them to stop smoking.